Hi, and thank you very much for checking out this video, and thanks as always to Kathleen Wayland of Wayland Financial in LaSalle for backing this weekly project. About 60 people crowded into the council chambers in Peru Wednesday afternoon at City Hall, and the reason was the latest public hearing relating to OSF Healthcare's local and regional plans. And the purpose of the hearing was for OSF to make the case that their plans for the region meet a regional healthcare need. And the healthcare provider intends to designate the Peru facility as its hub hospital along the Interstate 80 corridor. And this has caused some unrest in Ottawa, which stands to lose some services, but also would get a new hospital as part of OSF's regional plan. 20 people spoke on the modernization of the Peru hospital and the plan in general for the region, and all 20 supported the project. Not quite half identified themselves as OSF employees. A handful of speakers were from Princeton, and they were urging the board to greenlight the hub concept. Now, I wish there were a way I could have included every speaker, but I could only include a fraction, so I pulled some representative statements. So first you're going to hear from AJ Querchagrosa talking through the plans for Peru and making the case for the need for the OSF regional plan. Then I'm going to show you a little bit of what one person from Princeton had to say in support of the project. And when you listen to Tom Tester of Princeton say this, listen carefully to what he says about the epiphany experienced by the former Perry Memorial Hospital before it joined OSF. I decided to follow that with remarks by Ashley Freitag, who's an OSF professional who's experienced all the changes of the last couple of years there, and then Bill Zenz of IVAC with a business perspective. Then I'll come back and then we'll look at the mayors after that.
I'm AJ Querchagrosa. I'm the region CEO for the Western region of OSF Healthcare. Today, we are here about our Certificate of Need application with the state regarding our plans for OSF St. Elizabeth Medical Center here on the Peru campus. In terms of our Certificate of Need, specifically here is what we are planning on the Peru campus, some of which is already operational. We plan to increase the medical surgical beds from 38 beds to 45, increase our ICU beds from 4 to 8, maintaining the 11 OB beds at 11, and we'll have 1 C-section room as well. There are 5 ORs and 1 procedure room on campus. We will maintain the 10 ER bays, adding 4 EED stations to accommodate surges in volumes when we need them. Diagnostic imaging, including X-ray, fluoroscopy, mammography, MRI, CT, ultrasound, and nuclear medicine will also be available, including outpatient services, laboratory services, and pharmacy. All along, our goal has been to preserve and sustain access to high quality local health care, not only for the residents of the Illinois Valley, but really for the entire region. The state's CO2 planning area includes not only LaSalle County, but all of Putnam and Bureau counties, plus 2 zip codes in Stark. The Peru campus is centrally located within the planning area and is best suited for all residents. The investment OSF has made and will continue making in Peru is about $60 million, a big step toward maintaining a healthy and vibrant community. Just as you have trusted OSF to care for you and your families, we hope you will trust us in this endeavor.
My name is Tom Tester. I'm the plant manager at MTM Recognition in Princeton, Illinois. And I've been involved with local hospital governance for 27 years, and I'm currently a member of the OSF St. Clair Community Council. In 2018, the Perry Memorial Hospital Board of Directors sought outside education to apprise the board of forecasted healthcare challenges and trends. As a board, our revelation was a deeper interpretation of our mission, which was to provide quality, compassionate health care to the communities we serve. The epiphany was that our mission was not to maintain a hospital with all the services the community required. Instead, it was to provide access to these services. As a result, our decision manifested itself when we chose to join the OSF healthcare system in 2021, and we have never had cause to look back. The hub and spoke model for rural healthcare, with its hub being in Peru, will allow communities and citizens in the Princeton market a greater convenience in accessing the healthcare services we don't provide locally.
My name is Ashley Freitag, and I am the clinical educator for the emergency departments and hospital outpatient departments of the OSF I-80 region. My nursing career began 11 years ago at IVCH, where I experienced the merger with St. Margaret's. Then, in January of 2023, just 2 years after the merger, the Peru Hospital closed, ceasing all services, including the OB department. Less than 5 months later, then the Spring Valley Hospital also closed. These closures caused immense devastation and uncertainty for hospital employees and the communities they served. As a nurse, I never imagined that the day would come where I would be jobless due to the lack of available positions in the area. Healthcare is ever-changing, and to remain sustainable, it must evolve. We are no longer in an era where providers make house calls and multiple hospitals with all specialty services within miles of each other. It is not sustainable. OSF's plan for the I-80 region aims to provide the best care for all patients in the communities they serve while ensuring future sustainability.
Good afternoon, my name is Bill Zenz. I'm the Executive Director of the Illinois Valley Area Chamber of Commerce, and we are a regional chamber that covers almost the identical region of the I-80 OSF region, LaSalle, Bureau, and Putnam counties. I wanted to share our support for the work that OSF is doing here in Peru. The support and the services that they provide are extremely important as we look as a region to grow. When you look at employers or employees, one of the biggest things that they look for, in addition to education and extracurricular activities, is healthcare and access to quality healthcare. And again, OSF is providing that to our region, not just Peru, but the entire region that we cover.
If you're listening to this on the radio or streaming, this is a video-based weekly feature, and you can find all the videos stacked up at the Starved Rock Media YouTube channel in the Tom's Take playlist. Now I'd like to share some remarks by the mayors, Jeff Grove of LaSalle, Jason Curran of Oglesby, and Ken Kolowski of Peru. I'd like to also apologize here for not being able to show you some of the great comments from people like Alderman Tom Payton of Peru, Alderman Jerry Newman of Princeton, Don Trompeter of OSF, and others too. I'll tell you what, I'm going to try to post some of them as individual clips onto the station's YouTube channel so that you can see some of those too. So now you're going to see snippets of the comments from LaSalle Mayor Jeff Grove, Oglesby Mayor Jason Curran, and Peru Mayor Ken Kolowski.
I was very proud to see LaSalle was one of the first cities to make a formal resolution at our city council meeting a couple months ago to make sure that they had our support. OSF did. Being born and raised in LaSalle, St. Mary's Hospital in LaSalle, some of you folks might remember that hospital. I remember my father, as I was a young man, talking to a neighbor who was on the St. Mary's board at the time, and that's when St. Mary's came over to IVCH. It might have been People's Hospital at the time. And my dad was very mild-mannered, never got excited, never got fired up, but he was pretty fired up this day because he felt, hey, you know, as a city of LaSalle, we're going to lose our identification, right, when you lose the hospital. I think as time gone on, my dad and everybody realized it was probably the best thing for LaSalle Peru to have one hospital. We share a high school, we share a hospital, we share a lot of things. Right now, as mayor, our public works work together, our fire departments, our police departments, so it made sense, right, to have medical together as well. But again, losing that first thing is hard, right? So I was able to speak at IVAC last month. We had a State of the Cities, and my first words was thank you, OSF, for taking a risk on the Illinois Valley area, investment, as Kurt said, in the Illinois Valley, but also thank you, Mendota, thank you, Princeton, thank you, Ottawa, for giving us in LaSalle, Peru, Oglesby, Spring Valley healthcare.
We support the idea of OSF's plan for expanding regional health care throughout the region. A little less than 2 years ago, we lost our local healthcare facility in Oglesby, and then shortly after that, we lost both the hospitals, IVCH and St. Margaret's. So what that did is that took our average time from probably under 7 minutes to over 25 minutes. And I know there's other communities near us that had a much bigger impact to them. So Last fall, AJ and Dawn came out to some of the leadership meetings we had, and they kind of explained the plan, and I really appreciated that it made sense to me at the time, everything. I know there's some communities out there that are having some issues with the plan, and I get it. We are a bunch of small communities that make up a much larger population. So anytime a community feels like something is kind of being taken away from them or they're losing on something, everybody wants to fight to try to maintain that or keep that. But I think we need to be focused on the bigger picture and work together for a plan that's going to support healthcare, that's not going to allow voids to occur again. I will say that healthcare is a business, and as a red-blooded American, I tend not to trust businesses in general. But there's one thing about businesses I do trust. I do trust that they're out there to try to make a profit, right? They're trying to make money. And if IVCH and St. Margaret's would have been profitable and financially stable, we wouldn't be having these conversations today.
On January 28, 2023, we found out our hospital collapsed. Nobody's seen it coming. Our team immediately jumped into action, and we started making phone calls. We sent a team down to Springfield, started working with Representative Yednock and Sue Rezin. By the way, both of them were amazing in this process. And OSF stepped up, took the call. We started working with them immediately. First and foremost, for me, was the health of our citizens. That was a big part of it. But then you start thinking about the economic impact. How are you going to keep your young people? How are you going to keep your elderly people here? How are you going to attract businesses? We recently just landed a GAF $100 million factory that created 75 jobs. Would they have, the hypothetical question was, would they have come here without health care? I'm glad we didn't have to find that out. Bottom line is, folks, we need to listen, and we need to trust OSF, and we need to start pulling the rope in the same direction for the entire region. This is a regional thing. This is a national problem, and we're thankful that you're here.
Now, it wasn't addressed at this hearing in Peru this week, was the other side of the coin that I alluded to earlier, and that's the fact that this is not very welcome in Ottawa and the central part of LaSalle County. LaSalle County Board, Streeter City Council, Ottawa City Council have all passed resolutions against OSF and their plans. And they're trying to negotiate. Now, I always thought Ottawa would be the kind of city that would understand you can't impose your wish on a private business. You're losing some services. I'm sorry about that. I know what that's like. You say you're centrally located and it doesn't make sense. Yeah, you're centrally located in LaSalle County, but not in the universe, Ottawa, and not in the map of OSF services. That's where LaSalle, Peru comes in. Now, AJ from OSF went over the layout at the start, and maybe OSF's going to throw Ottawa a bone, but it's really coming off as a tantrum, and generally tantrums aren't rewarded. Thank you to Kathleen Whalen of Whalen Financial for sponsoring this multimedia project, and I'll talk to you in the morning.